Good morning, everyone. It's a pleasure to welcome Dr. Kartini Abdul to our Breakfast at UMHealth webinar series this morning. Dr. Kartini is a clinical microbiologist with more than 10 years experience in the diagnostic microbiology laboratory. She has been the departmental quality manager for ISO 15189 and is currently the departmental patient safety manager. So let's welcome Dr. Kartini. You have 20 minutes for your presentation, followed by a 5-minute Q&A session. For those who have joined the webinar, you can post your questions in the chat box, yeah? All right, over to you.
Okay, thank you, Prof. Chang. Hi, I'm Kartini from the Department of Medical Microbiology, and today I'll be talking to you about fulfilling the POCT requirements in a diagnostic microbiology laboratory. So this came about because currently we have an in-house POCT that's being offered to the endoscopy unit, and we are trying to go through what their requirements are in introducing this as a POCT for UMMC. So I'll be going through the ISO 15189 requirements for point-of-care testing, and there'll be just a brief introduction about what our ongoing example is that we have at the endoscopy unit. So the definition given by the MS ISO 15189 or international standards, which is the ISO 15189 for medical laboratory standards, they define POCT as point-of-care testing, and this defined as examination performed near or at the site of a patient. So these kind of tests, which is done at the site of a patient, can be a commercially available test, as you can see in the picture below, where you can have a line immunoassay on the bottom left picture, which can be a UPT test or any IgM, IgG serology tests such as dengue test kits, which can be done in emergency, or it can be it can use an equipment such as your blood glucometer, so that's also another POCT, or it can also be in an in-house test, which we have, as you can see on the far right picture, which is a rapid urease test that's done to detect H. pylori from biopsy samples. So the Malaysian standard for ISO 15189 in the 2022 edition, which was published in 2023, actually states the requirements for point-of-care testing, and this supersedes the ISO 2280, which will be withdrawn upon publication of this document. For Malaysia, basically the MS in front of the ISO states that it is Malaysian standards, which means that this document has been tailored to Malaysian requirements, but the original international ISO is just ISO 15189. So the 2022 edition is actually the third version, and the objective of this document is to promote the welfare of patients and the satisfaction of laboratory users through confidence in the quality and competence of medical laboratories. For the medical microbiology diagnostic laboratory, we have been participating in accreditation for the MS ISO 15189 since 2013. But for the other laboratories such as CDL, they would have had more experience compared to us, because they would have participated in the standards much longer than we have. So in general, for the requirements for any in-house tests, there would be general requirements such as what kind of documents that are required, and also dependent on the resources requirements, which can be divided into personnel requirements or facility requirements, reagent requirements, and also service agreements. If the POCT that's being used is a commercial POCT, you still need service requirements, and you still need to fulfill all the resources requirements as stated in the document. And if it is a POCT which uses an equipment or any external consultation, then you will have to fulfill those requirements as well, specifically for requirements for equipment requirements and also for external operators. For the process requirements, essentially the ISO, the standards actually specify from the moment the test is being born up to the point where the results are being conveyed to the clinician or the end user. there are certain standards that need to be fulfilled, and we're going to go through briefly for all these requirements that are required for POCT to be implemented in a diagnostic laboratory. So in effect, any kind of laboratory activities have to be specified and documented. This is a requirement not only for the activities that are done in laboratory, but any kind of activities that can be done other than the main location. For example, any POCT or any sample collection which is done outside of the laboratory have to be specified and documented as well. And it has to conform to the to the ISO requirements, as these are the kind of things when the external auditor comes, they would want to check that everything complies with the ISO standards. And the importance of the ISO standards is that with compliance to these standards, which we subscribe to, we have to pay for it. It gives our patients and all the other users and all other service users who want to subscribe to our work, to our kind of services, clinical services, it will give them the confidence because they know that we have a certain standard of quality which complies to international standards as well. So for resource requirements, it's divided for in-house tests. We have personnel requirements, facilities requirements, reagent requirements, and also agreement requirements. For the in-house tests that we're currently providing to the endoscopy unit at the moment, we don't use any equipment, so we don't need to fulfill any of that requirements. But if we were to swap this in-house test to a commercial test, then we still need to fulfill the same things such as personnel requirements, facility requirements, reagent requirements, and also agreement requirements. And on top of that, we need to have agreements with the external provider as well. So in general, the laboratory shall have available personnel, facilities, equipment, reagents, consumables, and support services necessary to manage and perform its activities. In general, for personnel requirements, there's a general requirement which states that we need to have sufficient number of competent persons to perform the activities. We also have competence requirements, authorization requirements, CPD requirements, and also personnel records that need to be kept as evidence of all the training that has been done and also the competence that for all the personnel, whether technical or non-technical, that we have within the department or within the institution itself. In general, not only the persons performing the activities have to be competent, they also have to be impartial and ethical when conducting their work, and this in accordance to the laboratory management system. The ISO 22583 provides guidance for supervisors and operators of POCT equipment, but if there's no POCT equipment being used, we don't need to comply to this because there's no equipment used. However, in situations where you're using something like blood gas analyzers or blood sugar equipment, then you would have to add on all the other guidances on top of the ISO 15589. The laboratory shall communicate to the laboratory personnel the importance of meeting the needs and requirements of users as well as the requirements of the ISO document. That means that the communication between management and also the people conducting the tests needs to be there, and it has to be proven with regular communication and also evidenced by meetings, whether it is email discussions or face-to-face discussions. Everything has to be documented, as this is one of the requirements when external auditors come. They want to know that there's communication from bottom up and from top down as well. On top of that, whatever POCTs or activities that is conducted within the laboratory, we also have to have it reviewed annually during management review meetings. This in compliance with the ISO standards. And this also gives us the opportunity to review the need for the POCT, and on top of that, to know whether we need to top up anything else as well. As for all organizations and institutions, we have orientation and induction programs, and this is in compliance with the needs of the requirements of the ISO standards. because there needs to be a program to introduce personnel to the organization and department or area in which the person will work, the terms and conditions of employment, staff facilities, health and safety requirements, and also occupational health requirements. For competence requirements, it's important to take note that there should be documented evidence demonstrating the competence of the personnel, whatever requirements for education, the qualification of the training of the personnel, any retraining that was done, and technical knowledge or skills and experience of the personnel, all of that has to be documented and kept within the laboratory or the organization to ensure that the staff conducting the tests are actually competent. And on top of that, there should be a frequent competence assessment conducted. In our case, we should do it annually for us to see that the staff who are doing it know what they're doing, and on top of that, the results that are being churned out are correct. Another level of authorization is required for personnel if they are to review, release, and report the results. This in accordance to impartiality and also ethical reporting. So in other words, there's an issue of confidentiality when dealing with patients' results. So that is why there's a clause in the ISO for authorization as well. And that has to be documented within the management system to state that who has access to what and what can be reported and who can do the reporting. Based on the Allied Health Professions Act 2016, Act 774, which has been implemented since 2020, if I'm not mistaken, all technical personnel are expected to have at least spend 5 hours in each 3 months period participating in activities of continuing education and professional development. So there needs to be a continuing education program or some sort of monitoring to ensure that the staff are always up to date with information with regards to their work activities. Unless directed otherwise by the accrediting body following a peer review assessment, instead of 5 hours, it could be increased to a different number of hours. So for molecular microbiology, the number of hours is actually higher than this. For personnel records, the laboratory also has to retain the records of the competence requirements, position descriptions, training and retraining, authorization of personnel, and also the competence documents of each personnel. Now, down to the facilities and environmental conditions, essentially, the place has to be safe for the patients, visitors, lab users, and personnel. And also, it has to be in a site where examinations that can be done. And it includes for all sites which are not done in the laboratory, but also done outside of the laboratory. So this is where POCT or sample collection takes place. All of that, there are actually requirements for the facilities and environmental conditions. They have to be safe for all the staff. For the reagents and consumables, there is a list of things that we have to do and ensure that there is documentation, paperwork done, whether it's on receipt and storage. There needs to be for acceptance testing as well, and also inventory management and instructions for use. Usually for laboratory tests, we don't have any adverse incident reporting. However, for some tests, when they are using hazardous materials, then there should be a monitoring and surveillance document or worksheet for adverse incidents. The agreements for POCT operators will be between the laboratory and other parts of the organization, or if it is an external body that's providing it, there should be an agreement as well. Sometimes the POCT committee can manage such service agreements, but there shouldn't be any issues about providing service agreements because we've been using blood gases, analyzers, and other equipment within the hospital for many years, so there should be service agreements available. For the examination process, then for every test that's being done, there should be a validation or verification method. So it depends. If it's a new test that has never been done, there should be a validation method. However, if it is a test that has been established, when it comes to the laboratory, it needs to be verified. So validation is an extensive way of testing whether the test that you're using has specificity and sensitivity. For verification, it's just confirm that whatever results they have provided is consistent. On top of that, there needs to be an external quality assessment, but sometimes some tests do not have EQAs. So there are acceptable alternatives such as participation in sample exchanges with other laboratories or inter-laboratory comparisons, or analyzing different lot numbers of manufacturers and use calibrator on manufacturer's tuners control method, or analysis of microbiological organisms, or reference materials, or patient samples from clinical correlation studies. So it's not just using RCPA samples or specific samples, because sometimes there are no bodies which can provide the EQA, the external quality assessment. So in addition to the requirements of point of care testing, there are also issues for governance. It means that the governing body is ultimately responsible for ensuring that the processes are in place for the accuracy and quality of the point of care testing conducted within the organization. There needs to be a service agreement, a quality assurance program, and also training program to ensure that the test that's being done would provide quality results. So back to the example that we've had, we were providing rapid urine test to the endoscopy unit. This test has been provided since the 1990s, and as you can see over there, these pictures are courtesy of Dato SHO from the endoscopy unit. There was a consensus done in quite recently, which states that they would advise testing their biopsy samples for H. pylori, because then this would affect the treatment and management for patients. So in 1994, for the current rapid test that we had, it was already been validated at that time based on a 1-minute rapid urine test that was described by Arvin et al. In 1988. So based on that publication that was done by our former colleagues from the department, specifically Professor Putupicheri and Prof. Parasakti, they found that the rapid urine test had high sensitivity and high positivity, but it could not beat the CLO test, which was extremely specific and had very good positive predictive value. However, the CLO test is more expensive, and the rapid urine test was a cheap method, and results could be acquired within 2 hours of the biopsy test result of the biopsy. So based on the checklist that we have for the laboratory activities in the ISO, we have fulfilled, because we have actually informed this to the POCT committee member, but for personnel requirements and the facilities, we have some things that need improvement. For example, we need to have some sort of competence testing, and for the facilities, we need to improve the facilities, as in the way the samples have been kept. And this follows the next requirement for reagents and consumables. There needs to be more checking done on how it's being kept, and also when the facility accepts the reagents from the laboratory, there needs to be acceptance testing, which should have not been implemented yet. So far, we have not had any agreements since the 1990s with the POCT operators, and this was only found out I was only informed about this like last month, 2 months ago. For the examination process for the test that we have currently, it has been extensively validated as evidence in the 1994 publication. We still require annual EQA, and if we can't find the annual EQA, we'd have to go with alternatives such as interlaboratory comparison. So that's all from me with regards of how we want to fulfill the POCT requirements for the diagnostic microbiology laboratory. If anybody out there who has some sort of POCT which the hospital does not know about, and you're doing it at the bedside with the patient, please take this opportunity to contact our lab managers or science officers and inform of whatever POCT that you have, so that we can all comply within the standards that has been provided. Thank you.
All right. Thank you, Dr. Kartini. So if there's any questions from the floor, you may put it into the chat box, or are they allowed to just shout out their questions? Liana? Sorry. Yeah, but while waiting, maybe I'll just start off with a very simple question. Kartini, thank you for your presentation. So I'm just wondering, are there a lot of POCT that's been used, currently in use in UMMC?
Yes, we have quite a number. So we have like initially there was a situation where we had the dengue kit that was done in ED. But I think there were issues about having the training done. And also we have like the ABGs, arterial blood gases that requires recruitment that's being done in ED or some other places. When I was a houseman, we used to do BNP, brain natriuretic peptide, for our cardiac patients, and that was done in cardiology lab, in cardiology ward. So that's another point of care test as well. And then like your usual, you check your blood glucose using the glucometer. All those are blood point of care tests. And then like in ONG, sometimes they use UPT for urinary pregnancy tests. All those are POCTs. So we have quite a number of POCTs that's being done. It's just that a matter of whether it has been informed to the lab, because the lab actually has to ensure that the requirements of the standards are fulfilled, and also to make sure that there's quality results being provided, because we go through the whole list of things from what the personnel needs to have, like the training, the competence testing, the requirements for the facility, the requirements for keeping the tests and all that. We go through all of that to ensure that the results that are being churned out are actually correct.
Okay, and among these tests, most of them are actually externally developed. Are there like a number that's in-house developed besides the urease tests, right?
Okay, so in the past, we've never had that I know of, we've never, well, except for the urease test, which was already done since 1990s. I've never heard of people using in-house testing. Because when I trained in the UK, we use flow tests, which is externally provided as well. So this was something that so far I know that UMC has. In the past, what we also used to have tests that were done in-house, which was developed in-house, but it's not for POCT. It's actually done within the laboratory. So this was the dengue sandwich test that was developed by Prof Shamala. So we used to have something like that as well. But if we were to continue having that test, it still goes through the same documents, the same route, all the things like for the personnel, the facilities, the reagents and all that. All those requirements are still in place as well. It's the same thing. The only difference for POCT is that it's on a site which is outside of the lab.
Okay, all right, thank you so much. There are no questions in the chat box. Are we done? Can we move on to the next one?
Oh, there's one.
Okay. All right, yeah. So, okay. The question here is, do we keep a list of those that has been wrong and has been challenged by patients as a result of care accrued from there?
Okay, for the tests by CDL and all the other places, I assume that it would be the same for medical microbiology. If we have like tests which are wrong, we actually have to do an RCA, mini RCA. We call it they're called as non-compliance. So we should have a record annually of that. And things like this have to be discussed during the management review meeting to know that how often it occurs and all that. So, but how long we've kept those lists, that one I don't know, because it's usually reviewed annually. And I'm not sure whether we keep those documents forever, because based on the archive requirements, we only need to keep our documents for 7 years.
And there's another one. How should we go about, or who to liaise with to ensure the training and quality of our own department POCT test?
Okay, so it depends on what kind of POCT test that you have. So for example, if your POCT is a microbiology test, so like for dengue or something like that, then it goes to the medical microbiology. You can liaise with medical microbiology. However, if it's a test which is under CDL, then you would have to liaise with CDL, because then they would have better idea of how to help you for the training and the quality of your results.
All right, and yeah, so a comment from the Yu Kun Chan, who asked the first question. 7 years is about right, because the statute of limitations from the court. If not, then yeah, can I pass it back to the host? So thank you again to Dr. Kartini for her very insightful presentation regarding POCT here.
Okay, thank you, Prof. Chang.
Thank you. Bye.